All right, good afternoon, everyone, and welcome to the Tempe City Council Work Study Session here in the Harry E. Mitchell Government Center for May 14, 2020. Due to the COVID concerns of COVID-19 exposure, the City of Tempe has implemented measures to protect our community, including closing of the council chambers and limiting public attendance to electronic means only. And members of the public may view the live meetings proceedings on Tempe Channel 11 and attend the meetings virtually through Cisco WebEx events by visiting www.tempe.gov/clerk for more information. Or you can also submit written comments via the City of Tempe speakers and comment card on the tempe.gov/clerk site as well. With that, the first items on our agenda is a call to the audience for the issue review session items. Audience members have up to 3 minutes to address the City Council. I would turn to our City Clerk to see if you have any emails, comments, or anyone calling in.
Mayor, we have 2 comments, 1 caller who's calling in, and 1 item to be read into the record.
Okay. If we could go to the individual that is calling in.
Lori Lundquist.
Hi, Lori.
Hi, can you hear me?
Yes, we can.
I'm actually, I submitted a comment. I'm concerned about the restaurants and food services, places where people are handling food, handling our credit cards, and not wearing protective masks, or not seeming to follow any sort of safety protocols. It's really concerning to me. I am very much in favor of businesses opening back up, but I'm also very much in favor of them doing so in such a way that it instills confidence in us, the consumers, to go in there. And I realize that it has become sort of a political thing, and it seems to be almost some businesses are following measures and adopting good, safe practices, and some businesses aren't. I'd like to know ahead of time. I went to pick up, takeout food at a restaurant a couple of nights ago. Not a single person behind the counter or in the restaurant was wearing a mask. And then I felt just very uncomfortable giving the person my credit card. He handled it, handed it back to me. And this is somebody who's in contact with, hundreds of people during the day. You know at this point that that people are asymptomatic and carrying virus. You know that it's real, and I don't know. I just feel like the city should take a clearer stance. I have read every COVID warning or update that's come out from the city, and right now it says that restaurant owners may consider asking their staff to wear masks, which seems so vague. And I think if I was a business owner, I'd be in a quandary. And I just think everything would be simpler if we just, as a city, just said people that are handling food and credit cards should be wearing masks and gear, or gloves if necessary, but masks at minimum. If that's not possible, then I would love it if the city would perhaps be posting a list of businesses that they consider to be following safe practices, like the sort of the gold star, sort of almost like a recognition for businesses that are adopting good practices, smart practices. I think it'll get us further down the road in terms of opening up. Thank you.
Thank you very much. Thank you for your time as well.
Sure.
Our City Clerk, do you have any other comments, or you have one you need to read for the record?
I have one to read into the record, Mayor. It's from Ron Tapscott, Tempe resident. He starts off, this was written May 12th. First, some numbers. The United States alone has more than 1.3 million confirmed cases, according to Johns Hopkins University Coronavirus Tracker, almost 6 times as many as any other country. But as of this week, the U.S. has tested only 2.75% of its $330 million population, and no state has tested 10% of residents. Dr. Anthony Fauci said if federal guidelines to reopen are not followed, little spikes will become outbreaks. He also stated that the real U.S. death toll is probably higher than the official figure of 80,000. Maricopa County COVID-19 data collection since January 22nd, as of May 12th, showed total number of cases 6,011, which was up 96 from the previous day. Total number of deaths 248, up 8 from the previous day. Hospital admissions 846, equating to 14%. Intensive care unit or ICU admissions 233, or 4%. It appears through Mark Mitchell's statements that the City of Tempe is supporting and endorsing the calls to reopen business per Donald Trump and Doug Ducey. The experts and evidence are clearly stating this is misguided. Infections and deaths continue to rise globally, nationally, and statewide. Pictures from yesterday's gatherings, referring to May 11th, shoulder to shoulder, no PPE, on Mill Avenue bear testimony to the misguided nature of Mitchell's statement, quote, "We trust residents will practice social distancing," unquote. All Tempe residents will share the risks in a continued and more pronounced uptick in infection rates from this flawed policy. The Trump-Ducey call to put superstition over science and opportunism over leadership should find no support in our city. I request that the Tempe City Council, at its earliest convenience, issue a proclamation renouncing the current Trump-Ducey edicts, return to a proactive stay-at-home policy, and call on all Tempe businesses to return to the previous safer manner of doing business. That concludes.
Great, thank you. And I know I've sent some emails back to Mr. Tapscott and some others stating some of the restrictions that has been upon the city throughout the cities throughout the state of Arizona as well. Thank you very much. With that, now we are going to go on to our issue review session items, and I will now turn this COVID-19 update to our city manager.
Thank you. Yes, Mr. Mayor, can you hear me?
Yes.
Great. Thank you, Mayor and Council, for this opportunity to update you and the public about the city's ongoing efforts to respond to the coronavirus pandemic. Our response continues. Our actions through our employees, both our frontline public safety employees and all of the employees that provide service to the community, to the city of Tempe, has continued unabated. I am proud, and I have mentioned this in previous updates, and continue to be so, of the collective efforts of all city employees to respond in the manner that they have during and throughout this crisis, and will continue to do so in the weeks and months ahead. Today's update is going to follow the following format. I'm kicking it off to introduce first our City Attorney, Judy Bauman, who's going to talk a bit about the governor's most recent executive order and the city's focus on reopening safely with our EOC, our Emergency Operations Center, and the guidance from our Reopening Advisory Committee. After that, Chief Greg Reese of the Tempe Fire Medical Rescue Department will speak to the purpose of the EOC and the commitment to help guide the city through reopening. After that, Jeremy King, who Deputy Director in Internal Services, and who has been chairing the Reopening Advisory Committee in the city, will talk about that committee, its purpose, and update as to what they are doing. Then lastly, our Strategic Management and Diversity Director, Rosa Inchowski, will provide a brief update about wastewater analytics regarding COVID-19 and some of their updates and preliminary research and findings. So without further ado, I will hand it over at this point to Judy Bauman. Thank you.
Thank you, City Manager Andrew Ching. So I wanted to update the mayor and council that we had significant activity at the state level this week. On Tuesday, Governor Ducey issued Executive Order 2020-36 and attendant guidance, which basically allows most businesses to open, subject to keeping with CDC guidelines for physical distancing and some other requirements by May 16th. Part of the governor's requirements in the executive order mandates that any business, whether for-profit or nonprofit, institution, profession, or entity that physically operates in this state and serves the public or is an employer shall develop, establish, and implement policies based on guidance from the CDC, Department of Labor, Occupational Safety and Health Administration, referred to as OSHA, and ADHS, which is Arizona Department of Health Services, to limit and mitigate the spread of COVID-19. This includes promoting healthy hygiene practices, intensifying cleaning, disinfection, and ventilation practices, monitoring for sickness, ensuring physical distancing, providing necessary protective equipment, allowing for and encouraging teleworking where feasible, providing plans where possible to return to work in phases, and limiting the congregation of groups to no more than 10 persons when feasible, and in relation to the size of the location. So following this guidance and reminding that our local Tempe businesses are required to comply with state law, particularly those who already have existing security plans, the City of Tempe is looking at a gradual reopening and recovery phase for our city facilities, programs, and parks amenities based upon this data and following the recommendation of our Emergency Operations Center, the recovery section headed by Assistant Chief Andrea, based upon the Employees Reopening Advisory Task Force led by Jeremy, who will be speaking later this evening, and in keeping with the six-sided partnership, which is our employee bargaining groups. And all this is done with maintaining the screening protocols and the physical distancing that's been put out by our Human Resources Department. So with that, I will turn this over to our Fire Medical Rescue Chief, Greg Reese.
Thank you, Judy. Good afternoon, Mr. Mayor, members of council, as well as City Manager Andrew Chang. First thing I'd like to do, if we can go to the next slide. First thing I'd like to do is introduce you all to our new emergency manager, Michelle Seitz. She has just recently joined us from Wisconsin, where she was working in the state EOC there and part of the leadership team that was helping to guide them through the same challenges that we are currently facing. In previous COVID updates, I have referred to the City of Tempe's Emergency Operations Center. And today I would like to take a few minutes and share with our community the coordinated work being done by mayor, council, and all of the city departments in response to the COVID pandemic. Today, we are in the 53rd day of operation. The EOC has been operating virtually Monday through Friday from 8 to 5. And as you can see in that photo, this is unlike any drill or any exercise we have ever been through. We are working virtual. We're working in a virtual environment when that room would normally be filled with all of the representatives from the various departments. Part of what I want to do is not only share with you what has been happening in this virtual environment, but I want to also express how amazing it has been to see all of the departments come together in a coordinated effort and do the things they have done for this community during these very challenging times. Next slide, please. On the screen, I will go through these bulleted items, but I've put up here a org chart that is the most current org chart, and in it, it shows how the city, though we have shut down some of the facilities, the department heads and those work groups have turned all of their attention to the EOC operation and again have coordinated all their efforts in trying to provide the safest workplace to return to, as well as a safe environment for our community members. The EOC sections that we have in operation are depicted up there. They are designated sections which are staffed by different department personnel from all over the city. For example, this is not limited to, we have the city attorney, community services, human services, IT, internal services, budget, finance, PD, and fire, as well as many other departments. The sections are divided into the following working sections, but the ones I just mentioned work within these sections. You have a planning section, an operations section, a logistics section. You have the incident command, which is currently the incident commander is Assistant Chief Daryl Duty, but we work very closely with the police department in that area. We also have admin, finance, liaisons from safety, PIO, intelligence, legal, and as mentioned earlier, the recently added recovery. Each day or 8-hour period in the EOC is called an operational period. We create a document that is called the Incident Action Plan, which includes established objectives by each section for the next operational period or workday. These objectives are essentially goals each section will be working on to accomplish over the next 8-hour period or the next day. The purpose of the objectives are to continue to provide direction in each section, track progress, identify future needs or weaknesses in the city, and formally document all items which will be used in an after-action report to improve our future operations. We conduct daily briefings with the assigned EOC staff to review the previous operational period, and the objectives for the next period are established. The EOC section chiefs provide briefings with department directors, the city manager, and the deputy city manager, and other parties 3 days a week. We also report out to mayor and council. The City of Tempe EOC, the City of Tempe PIO team meets 3 times a week to discuss communications topics for the community. We also participate in a state and county joint information center call 3 times a week to know what is occurring at the state and county level. Designated members of the EOC team participate in the Department of Military Affairs, state EOC, and county EOC briefings, county public health briefings twice a week, and CDC briefings once a week. We also are working with the multi-agency coordination working groups throughout the week. So we have a constant flow of the most current information at our disposal at all times to help us make the most appropriate decisions. Recently, we have added the recovery section or continuum. This this consists of a sequence of interdependent and often concurrent activities which will progressively advance our community toward a planned recovery. The EOC will continue to operate and all sections will remain active until further notice. And within the recovery section, the decisions will be made through another coordinated effort by representatives from each department to come up with the best plan to return our workforce back to work and assist our community in getting back to where we need to be. At this time, I want to introduce the reopening task force leader, Jeremy King.
Thank you, Chief Ruiz. City Manager Ching, thank you. Good afternoon, Mayor, Vice Mayor, and Council. Again, Jeremy King, Deputy Director of Employee Development and Chair of the Reopening Advisory Group. For the last 2 weeks, the 44 individuals representing all City of Tempe departments have been working on recommendations to reopen our City of Tempe facilities and services, as well as provide continued guidance to the critical employees who've been working through the entire pandemic. If you go to the next slide, you'll see our mission is to provide innovative, data-driven recommendations to reopen the City of Tempe so that employees and residents feel safe. Our guiding principles along the way is to give a voice to the employees and the community in the reopening process. On the screen, you'll see some actual preliminary results. Within 24 hours, we had over 600 responses to our employee survey. And this question particularly asked about the priority we should place on health, economics, or social factors as we decide on reopening areas of our city. You can see 83% said it was the most important factor as health, along with 11 putting it at their second. So first and second choice of 94% there. As we move forward, we want to apply these cross-departmental learnings from COVID-19 adversity to also create a better Tempe now and into the future. So not just open the way we were, but learn from these experiences and open even better as we move forward. Some of the goals of our group is to review guidelines that come in and policies for reopening as departments are starting to craft their vision for reopening. We are also surveying those employees. As I stated, we are up to almost 1,000 responses as of this evening, and document that so that the employees feel safe as we are reopening, so that it can be used not only in the decision of when to reopen, but how to reopen. We're developing these recommendations and guidance based on our national, state, and local data, and encouraging departments to create action plans in order to reopen in a Tempe phased approach. This 4-phased approach will start with a phase 1 reopening, phase 2 and phase 3, and then look even beyond through the recovery section into that 4th phase as we look from this pandemic and look into the future. We want to prioritize the safety of employees and our community throughout this process. That for you today, so I will turn it to Rosa and Steve for the next presentation.
Good evening, Mayor, members of the City Council. This is Rosa and Chastity, Director of Strategic Management and Diversity. I think it's the next slide that we need. Thank you. Thank you for the opportunity to share with you and our community about a new emerging science and innovative approach we are using in Tempe to fight COVID-19. What you see before you is basically a snapshot of the wastewater analytics hub site with the address there in the corner, covid19.tempe.gov. And we really encourage our public to look, because what I'm sharing with you tonight is only 3 slides of the very extensive hub site and dashboard that we have worked on at the city. So wastewater analytics, what exactly is it? Scientists call it wastewater-based epidemiology, which is a fancy word for saying in lay terms, it's a way for us to use science studying the sewer system for public health and for public health information that will give us clues on what is going on in our community. So a relatable analogy that perhaps everyone can understand is we've all been to a physician's office and we have blood work taken or urine samples or even stool samples. This is the same concept on a much larger level, on a community-based level. So those are all traces of information that are shed by our community members or anyone coming to our city about things that are going on within their own system that tells us more about what's going on in our community. Next slide, please. So we always think a picture is better than having a narrative about the very technical process of the wastewater work. And what you see before you is a graphic that we've identified that perhaps helps to explain the process. So the testing wastewater for COVID-19 starts with the community. It starts with our community and it ends with our community in mind as we make decisions. So as you see on the far left, it starts with the community using the restrooms. Everyone who is in Tempe using a restroom, whether you're visiting our city, but really right now, everyone's sheltered in place. So those who are our residents are using the restroom and adding and contributing to the science project. The wastewater stream is collected by our water utilities employees or environmental services. And I got to thank Chris Garcia and Richard Dalton, who are really collecting these samples at the sample sites of our areas throughout our city 3 times a week and delivering those to the ASU scientists on our ASU campus. So they physically set up the sample sites one day, and then the next day they pick them up and deliver them to ASU. The ASU scientists pick up those samples collected as we see on the top there. The samples are there prepared in the lab for analyzing, as we see in the next graphic there. We then have Dr. Ralph Halden and his team and the virologist review all those data samples and give us the data. We then sit down and analyze the data and what it means, and I will be showing you with the dashboard. And more importantly, this is the process that I think sets Tempe apart from other cities that perhaps are looking at wastewater epidemiology. It's that graphic of a city decision-making process. So over the last 3 years, our city has really moved fast and forward on using data-driven decisions making sure that we understand that our decisions are based on logic and information, stats, that we can then explain to the public why we are making certain decisions. So as you see the pyramids there, city decisions in helping us make the next step, or making a decision for strategies. As we identify that, we recognize this is an emerging science, and that we have to couple it with all the other data that we may have regarding COVID-19. So we do have the data that is identified by the state regarding our zip code that is coupled with that information. More importantly, we develop and implement strategies, and that's one of the things that we would like the public to understand, that it's not just said alone, that we identify the strategies that are taking place. So for example, we have been sheltered in place, and now with the governor's orders of opening businesses, we will look at the dashboard to see if there's any changes to our wastewater data that we are receiving weekly. We come together as a city to analyze outcomes and impact our community. And then we adjust our strategies based on the information we are receiving with that data. The research and the lab produces what we call COVID-19 gene copies per liter. And I know that seems very complicated, but it really boils down to the best way is if you can just imagine salt in water. How many salt particles are there? Does it amount to a higher level or a lower level? And that's probably the best way we can describe what COVID-19 gene copies are, but you will see in the dashboard that it's identified as that. Next slide. So in the dashboard, in the hub site, in the middle of the narrative, we have the dashboard. And as I mentioned, the sample sites are divided in our sewer system with 5 collection areas, as you see on the left, in different colors. What we try to do is identify, thanks to Dr. Stephanie Dietrich and her team, is identify a very simple visual tool that everyone can see weekly what this graphic is looking like and what the data is showing us. So just take a step back. The wastewater analytics program actually started 2 years ago with our opioid work within the city, is checking for opioid basically use in our city through our wastewater. In March, Dr. Rolf Halden and his team approached us with the outbreak of the pandemic and said we could try to identify the coronavirus. And thanks to the leadership and the courage of the city, we said, yes, let's try to do this. And we worked together with ASU in partnership. So what you see in the graphic right on 4/6 through 4/12/2020 on the left, or right in the center, is the blue line that corresponds with area 1. The reason you don't see any other data points for that time was because that was when we were sampling with one sample area to see if that was possible. It was possible. So then we went to work and started sampling all the other areas. We didn't want to collect samples that we weren't using, and more importantly, we didn't want to waste any resources that City of Tempe has from the public if we weren't able to isolate the coronavirus. So as you see, we have area 1, and then you see we created a below quantifiable level right in the center is that dotted line across the dashboard. That is to explain, on the left, we have the milligrams, or how many meters of copies of gene copies we have of the coronavirus in the water stream. So what we understand that the City of Tempe is the first to do this. There are no dashboards out there. Other cities are trying to create some type of dashboard, so we have to create our own trend lines because we have no benchmark. When you're first, it's hard because we have nothing to compare it to. So we have to create trend lines within every week in order for us to compare, are we seeing a trend going up or down? So in that first week, we see that obviously in that area, the copies were higher. As we progress into the week 413 to 419, we see 27,000 copies of the genome copies of virus. And then as we move forward, we started having the sampling of the other areas that you see, with a spike in area 2 with 62 million copies of genome copies. And then we see actually in the recent weeks, 427 through 5/3, everything what scientists call non-detect. So that's very important because one of the things we discussed with Dr. Rolf Halden, in lay terms, non-detect would give a false expectation to the community saying that there's no coronavirus detected in our community, which is not true. We honor the scientific vernacular, so we have to use the non-detect, but that is why we created a below quantifiable level, so people know there is some, but it's not detectable to the level that scientists use as quantifiable. So what this tells us in the last couple of weeks is that the shelter in place has worked. We see the areas of our city leveling out right below that quantifiable level, at or below the 5,000. So it'll be interesting as moving forward what our weekly samples will show as the strategies really within the state, and even moving forward with our city as we open facilities and senior centers and parks, how we use this data and deciding what we want to do. So we will be monitoring closely alongside our city officials and more importantly, alongside our community, because as we said, this is emerging science and we need to be open and transparent about its opportunities, but also its limitations. And that is all I have, and I think I turn it over to our city manager, Andrew Chang.
Thank you very much, Rosa and team, for your presentations. At this time, we are happy to answer any questions that Mayor and Council have.
Thank you, Andrew. I have one question for Jeremy King. Does the Reopening Advisory Committee, are you looking at any potential dates for us to look at reopening? This is for Jeremy.
Thank you, Mayor. Am I off mute now?
Yes.
Okay. Yes. So we received our first phase 1 committee has put together a recommendation in detail as to their recommendations. And while we know that some of the estimated trigger points for reopening could vary, their estimated date would be June 15th. That gives time for the reopening of some of the state to have time to see the results from that and really assess that we are moving in the right direction and safely reopen our city. From that point, we could have recommended dates that phase 2 and 3 are working on that probably would fall in line with 14 days or so after each phase. And each department or division or program would decide what phase 1, phase 2, and phase 3 reopenings based on the guidance from the advisory group.
Okay. Thank you. That's helpful. I see a hand up, Vice Mayor.
Hello, can you hear me? Whoops. You want to see my fan? Yeah, question for Jeremy, and I have some other questions as well. But Jeremy, I imagine when you're talking with a group about the phases that you're looking at, there's probably a phase 0, right, where we're closed. And I imagine that the phases aren't necessarily linear, that there could be a phase 1 and you have to go back to phase 0, or there's a phase 3 and you have to go back to 0. I imagine it's not a straight linear progression because we know the virus there could be an outbreak at any time.
Yeah, thank you. Thank you, Vice Mayor. That is completely understood, and we are looking at those trigger points also. As you know, we are working with the EOC in the recovery section, so we're really in line with the data that they have, and we also recognize that these will be Tempe phase 1, 2, and 3. There is phases going around us, but we are specifically looking at Tempe and what we will be projecting for reopening in those particular phase groups.
Thanks.
Well, I want to say that I'm really glad that the city of Tempe is taking it nice and slow. We're not rushing into anything, and that I really want to applaud the city manager for appointing an employee-led group that will guide us through process. Fundamentally, we need to look at public safety and employee safety. So I so appreciate the way we've constructed this. This isn't, a decision for council to make. It's a decision for the employees in the upper level administration. So thank you.
I want to go to Councilman Navarro, then Councilmember Adams.
Thank you, Mayor. First, maybe for Jeremy and the group, and I must have missed it, but on your group size, with your group size and the makeup, was the size of the group a problem? Would a smaller size be better? And then within the group, was there any categories of expertise in certain areas? Can you explain the group makeup if you could?
Sure, the group is made up of 44 individuals, and it is a large group. And when asked to facilitate it, one of the first things we did was to break it down into subcommittees. So each subcommittee has approximately 15 individuals in it that is working on the particular phases that they have been assigned, and then we come together to vet that information. The representation is interdepartmental across all of city departments. So we are dealing with all the departments, so the expertise is there, and then we are seeking additional knowledge through the EOC and data points around the state and nation. So we are striving to provide the best possible information and use that as recommendations to drive departments into a planned reopening phase so that they are making the best decisions for their groups.
Gotcha. And anything would you any tweaks you would do with the makeup, or any tweaks you would do with anything within the group?
Well, right now we are moving in a good direction. I think that we have 15 of them working that will be more aligned with the EOC recovery plan. And right now, I feel like we're getting good feedback. We've only been together about 2 weeks, so we can reassess in the future the size of the group. But it is a real voice of the employees, and the surveys that we are receiving back is also going to add to that voice of the employees. So I think we're driving in a good direction, but we will reassess as we see time pass.
Right. And the only reason I mentioned that is I think a lot of us have been involved in a variety of discussions, and obviously I've been with the city of Phoenix and with the PPE and the region and stuff, and often either it's good or bad. Group size could work great, group size can work against you, and I'm trying to just make sure that we're doing the proper steps to work in the right direction, and that's why I ask these questions. If there's anything that we need to look at, change, or whatever, reassess. I like what you just said, just to make sure that you guys are on the right track. I love the fact that you guys have input from a variety of different sources out there. At the same time, I want you guys also to be functional, to where you can really make some good determination on what the outcomes should be and recommendations to the council, because I think it's very important as we go forward. In terms of or talking about the dashboard with Rosa and her team in collecting the data, working with ASU, I can only say, Mayor, that this is probably one of the pride points of my council career, to see something that started from the opioid committee to morph into public health, so to speak, and what we can utilize with this information and what we can hopefully perfect over a course of time here with other illnesses or other health concerns that might come down in the future, that we are going to be one of the cities that's going to be in the forefront of being able to detect any virus or any illness that's out there that might be in the category of a pandemic state. But also, I think it's great information just to inform our residents the value of just maintaining and monitoring personal health. When we go through this crisis, long and short is this is a pandemic that is hitting people with underlying conditions mainly, and it kind of strives to the point of as a community, we need to make sure that we give those options of giving our residents the ability to take care of their bodies, take care of the health, and provide those options out there. It may be workout facilities in the park, workout facilities at the Kiwanis Club, rec centers, classes on better ways of eating, a whole bunch of stuff. Same farms, farmers markets. community involvement, all of those play a part in what we're trying to overall see, because long and short with the coronavirus, we can do and we should be doing all the things to limit the exposure with masks and gloves and things like that. But as you saw from maybe a couple nights ago or last night, an ABC reporter who reports on various outbreaks of different types of diseases across the world caught the coronavirus, and he was actually wearing gloves and masks, and he thinks he caught it on a plane. But taking all the precautions needed, he still caught it, but weathered through the storm, and he's on the other side of this thing. And that's just, you know, with more or less with him is probably his health and maintaining. But once again, it just drives to what we're seeing, what we're collecting within our community, making better judgment, better decisions out there for our residents, having our residents having the ability to look at this stuff and to see how we're doing. Because we can see over a course of a week if we're trending up or trending down, and we can start making logical decision-making strategies within those geographical areas and how we're going to go about things. And then the other thing I want to stress, and I think this is very important for the city manager and everyone else to hear, we need to put this dashboard in a place on the website where you can access it. I'm trying to get through it right now, and I'm trying to find out how to and where to get it from. And I'm stumbling across and getting to different areas. This has to be something like a banner, something very easily accessible, because this is going to be on the forefront of a lot of people's minds. And if we have the ability to provide this information, then we need to provide it, and we need to provide it with ease. So the advertisement of this, I think, is going to be very important for us to get that information out. And I'm excited, you know, that we are sharing this information. I'm excited that hopefully others can utilize it. I know there are other cities that have been inquiring with ASU to do the same thing we're doing. But we are the catalyst of making this thing happen. And I just want to say thank you to our staff, Rosa and ASU, Dr. Rolfe. I think this is tremendous, and I know that we're going to utilize this information to drive us in a better direction. And I think it's going to really get the state some comfort, because I know at the county level, this information is going to be widely accepted to make sure that their data is checking across, you know, with what they're seeing too. So I'm excited what's going forward, and thank you so much.
Thank you. We're going to go to Councilmember Adams, then Councilmember Arredondo Savage. Councilmember Adams.
Can you hear me?
Yes.
Okay. A couple things. First of all, I want to thank Rosa, Ken Jones, and ASU for your leadership on this project with the sewer systems and identifying the coronavirus. This is a big deal, especially since testing is in such short supply. So to be able to identify where coronavirus is huge. It's going to save lives, and it gives us knowledge, which gives us power to save lives. I appreciate the wonderful relationship that you established with ASU, and am anticipating the entire country will be reaching out to us. Once again, Tempe is going to be a leader in the country, and I'm so proud to serve on our council. Joel said a lot of the things that I wanted to say, so I'm not going to repeat those, but Joel, you did a great job covering them. And finally, I would like to ask Jeremy, first of all, good work, Jeremy, on leading the committee. I encourage you to go very slowly to make sure we get it right the first time. This is about saving lives, and I just think we need to go slow and really look at all the factors. I do have a question for you, Jeremy, just out of curiosity, where is your committee on recommending masks use?
Thank you, Councilmember Adams. Yes, we are definitely looking at mask use. We are working with risk management, and then the EOC. They have an entire group dedicated to making sure that we have the personal protective equipment that we need here in the city of Tempe. We are formulating some recommendations around masks for employees and possibly the public. We are checking with legal to make sure that we are in line with any state laws, and moving forward, we're going to have them as part of our recovery plan, knowing that as we plan for these reopening phases, we'll have to know the personal protective equipment that it would take to do and execute the plan that we want to see fit. So we are definitely weaving that into our plans moving forward.
Thanks. Now we'll go to Councilmember Arredondo Savage, then Vice Mayor.
Thank you, Mayor. I certainly do appreciate it. Just a couple things. A lot has already been said, but I do want to give a quick shout out to Joel Navarro. It was, 2 years ago that we really took a stab at trying to address opioids within our community, and part of that was being innovative and working with the partnership at ASU to test our wastewater. And if that hadn't been established 2 years ago through the opioids committee, we wouldn't be where we are or have the ability to pivot a little bit and test something that's really relevant and important today. So thank you, Joel. Thank you, Rosa, too, for your outstanding leadership and the team that you brought together to make that happen 2 years ago, and continue to make those things work and be very helpful to the city of Tempe. I think as we move forward, obviously safety is going to be really important, not only to our employees, but to our residents. And being able to utilize innovation like we have in the past, I think is going to definitely make us leaders. But I think with being leaders within the state, gives us great responsibility too. So that means we have to try to do our best to set a good example, to be good leaders, and to try to get it right as we possibly can. Now, I would say, I know that was said earlier, but at the same time, I realize these are very unprecedented times and we have to make decisions. And sometimes maybe we have to be flexible within those decisions or make changes as we see what the outcomes are to that. And I certainly understand that. So Jeremy, your work on bringing this group of over 40 people together, which I will tell you, I had some reservations about. I was a little concerned, I think like Joel was, about being able to really rally that and make everybody be effective. And it sounds like you kind of got it squared away a little bit, in the sense that it's manageable and people are really making some, utilizing the data, the information, and the resources to make some good choices and some good recommendations for the city. I think the one thing I would ask is, as we move forward, is that we make sure that we have the ability to provide all the resources, changes within our workstations, whatever it may be, to make sure everybody feels comfortable as we do begin our phased-in approach to opening, to restarting. Because I don't want to say people are going back to work, because people have been working. We have some outstanding staff members that are doing a lot of excellent work from their homes, or some even coming into the office. And I just really want to every time I get a second, I want to say thank you for that. But I think it's going to be really important that we make sure that we have the resources and to do check-ins along the way, and we can start installing those. Because I can't imagine just saying one date of June 15th as a drop dead date. So as that phases, as we phase into that, it'd be good to get to know a little bit more detail of what that might look like. Because I'm sure there are some departments, some people that are working from home, that it may be more opportunity for them to be at the office. And I get that, I understand that. So there may be some levels of priorities of where we do need to make some changes, or we're going to be interacting with our residents, with our customers. So to understand that as we go through this would really, really be helpful to make sure we're making good decisions, making sure you have the right resources that you need, that we need as a community to open up. But, thank you for your work on that. And I look forward to getting even more detail than you gave us today.
Lauren, thank you, Robin.
Thank you, Mr. Mayor. So we've heard a lot from residents in the past few days, and we've had that horrible example of a lack of personal and business responsibility that took place at 6th and Mill. None of us were happy to see that. It showed that we weren't ready. Definitely the state isn't ready to reopen. That's my personal opinion. But I know there's groups like the Arizona Small Restaurant Coalition, and they have guidelines, and fundamentally they formed as a group in mid-March, and they determined that when they thought about reopening, they thought customers want to know they're safe. Employees want the ability to return to a job that won't put them and their families at risk. And thirdly, without public confidence, small businesses like ours won't succeed. And then lastly, public confidence depends on clear guidance. And So, we've seen the case with La Casa this week. Maybe the restaurants don't have clear guidance. And there's always this tension when you have guidelines. Should they be turned into regulations? Are they recommendations? Is it just a request? We want to educate. There's a lot of confusion. There's a lack of clarity. I would say that the clear guidance is not there yet. And I know, speaking with Kate Borders, Downtown Tempe Authority, and Thomas Barr at Local First Arizona, they're working on guidance for restaurants that they could put out there, and then restaurants will hold on to these to be certified as a business that has sort of a gold standard, a public health standard. And I'm really interested to see what they come up with. But from all the emails we've gotten the past few days from our residents, there's a concern about masks. And I thought it was very smart of the city to take what is already a law and in our statute security plans and add social distancing into that requirement. So I would ask, why can we not put some measure of mask wearing into that security plan, a measure that would protect fundamentally the servers, the bartenders, the bussers, the hostesses. You think about in the old days when you would fly and you could smoke. It wasn't so terrible to be exposed to smoke maybe for a half an hour, but the flight attendants are exposed to it their entire work shifts. It becomes a work safety issue. I'm tremendously worried about servers, about the restaurant workers on Mill Avenue and their constant exposure to the virus, community transmission. And we know that, like UV rays, it's cumulative. So you can have a tiny bit of exposure that's not going to get you sick, but if you're exposed to tiny bits for every day for 5 minutes, you get the virus. And I know this isn't an easy area. I know it's not simple. I know that it would be really difficult, for example, to enforce mask wearing for customers when they're drinking and eating. If the police came and said, you're not wearing a mask, it's like, but I'm eating. And it would be absurd. I see that. But I also see that there are going to be restaurants and bars that serve food that are not necessarily going to be good actors. We've seen that just this week. And that was hopefully a teachable moment, and that won't happen again. I know the majority of businesses want to act responsibly. They want to have customers. Public confidence depends on clear guidance. And without that guidance and without that confidence, these businesses won't succeed. So I'm wondering if staff could go back and look at what we can do to either require a mask, to either have a messaging program. I know that the HRC, our Human Relations Commission, just sent us advice a half an hour ago. They really want to see a mask policy in the city of Tempe. They're very concerned. They weren't necessarily talking about businesses, but can staff go back and figure out a way that, whether it's including it in the security plan, and I realize it's only limited, it's only bars that offer food, that's only hotels and cafes, it's only a certain number of businesses that it covers, but we all know we're not at the beginning of all this. We're not in the middle of all this. We're at the very, very beginning. This could be going on for a year, it could be going on for 2 years. We need to, at this point in time, this early point in time, do what's right so we don't slide back in and have a bigger outbreak than we even had before. So I'm hoping that we could have some consensus that we should at least look into the mask policy, look at the HRC guidelines, for example, talk to the Chamber of Commerce, the Local First Arizona, Downtown Tempe Authority to see what their recommendations were. Maybe it's just that a messaging campaign will come out of it. Maybe it's a requirement that businesses offer masks and don't retaliate against workers who want to wear a mask if the business doesn't want it. But maybe we should have some kind of clearly defined policy, because right now we're in the muck. It's not clear. We don't have clear guidance. And without clear guidance, we're going to have continually these little outbreaks at restaurants or bars, and we'll have to deal with that and it'll become a public news story again, a national news story again.
Thank you. And before we answer that question, I'd look to my council colleagues I see Robin has her hand up. The thoughts, but also given the governor's guidance, it does say that restaurants should develop a standard for masks for employees, but it's not made as a requirement. But I think that's something that we could look into, but I'm going to go to Councilmember Arredondo Savage. Robin?
Thank you, Mayor. Yep, sorry. It's a little far away from my button there. Just a couple things. first and foremost, I think it's always a positive thing when we bring our partners together and have a conversation with the chamber, DTA, Local First, the Restaurant Association, and see if we can create some type of health standard within these times. Because I agree, we don't know how long it's going to last, and I think that the clear messages or information we can share with all of our businesses would be really helpful. I mean, being part of a small business too, I always err on the side of I don't like to mandate and require people to do things. So I struggle with that. However, I do understand that there are clear health risks, and I think maybe creating some type of joint messaging could be really helpful in regards to strongly encouraging and what that might look like, because it may be different within different types of businesses. And it's my understanding, talking with Ann Gill, that they are working on some type of reopening of some of these businesses that have been closed and implementing health standards. So I certainly would support at least the idea of working with our stakeholder groups and finding out if there are ways we can help our businesses to be the healthiest they can for not only their employees, but for the patrons that want to utilize their business too. So, and I'd rather do it together than with a mandate. Thank you, Mayor.
Thanks. Councilman Navarro?
Thanks, Mayor. Yeah, no, I agree with Councilmember Ardana Savage. I think working with our partners and kind of hashing this one out to make a good policy for everyone to utilize. I think obviously for people that are going out using the restaurants, I think for the most part, I've gone to a restaurant, we brought our masks out, sat down, tables were spaced out appropriate distance. This is in Tempe. We obviously took our masks off because we had to drink and eat and do all this stuff, but it felt like a very safe and appropriate environment. And I know that even in that setting, we're still at risk. We're still at risk for any exposure that could happen. We're not going to be immune to it. And once again, I think that the more you can do to help fight it, the better off you're going to be. But I would there's a little bit leery. I'm a little leery of mandating something unless we were collaborating. So I worry about that. I know that before this epidemic, the biggest concern was the fact that we could not, for public safety, get any masks. And we went through a whirlwind. We're still going through a whirlwind a bit to obtain masks, and we're still not out of the woods of that. So when you do a mandate, that means there's going to be some other effects that possibly could happen from that mandate. So we got to be mindful of everything that we're trying to do and the prioritization of who might need it first. So anyways, I think that it's all been said, but I think getting a group together would be advantageous.
And I just wanted to reassure the council and those that are listening or watching that I do have a meeting scheduled tomorrow with a stakeholder group that we put together a week ago with Local First, the Tempe Chamber of Commerce, the Downtown Tempe Authority, Arizona State University, and the Tempe Tourism to get feedback and some their thoughts. And I think it's always important that education on a larger scale. I've been talking about that for the last couple of days, since Monday actually, about how important it is to educate on the social distancing guidelines that we do have. The Restaurant Association, I believe, also is issuing guidance to restaurants and bars that we could all work together and implement. And I think it'd be good if we can reach out, ask Andrew to sum up, but look at some of the opportunities in messaging with an educational campaign on social distancing and the COVID guidance and the guidance from the CDC as well as from the Arizona Department of Health and Human Services. I do know that Councilmember Keating or Vice Mayor has a hand up, and then Councilmember Keating. Vice Mayor. And before that, we need to go to Judy before we go to Andrew.
And just to sum up, a lot of these measures you're talking about, if there are costs, masks, they're all extremely cheap compared to reclosing and then reopening the economy. And I know the governor does require that any open business follow CDC guidelines, and CDC guidelines are to wear cloth masks in public, and this is quote, if social distancing is difficult to maintain. A waiter doesn't generally stand 6 feet away from a customer. Even so, are they going to carry around a yardstick? There's there's just important worker safety protection. So I urge you, Mr. Mayor, when you do have a conversation tomorrow with the business advocacy group, to talk about the position of the workers who will have face constant exposure. And we do have this requirement from the governor, but we're, again, as I get back to what I originally started with, it's this all guidelines and regulations. The governor can say, yes, you must abide by guidelines, but the guidelines themselves, there's not a requirement there. So we need to find a way to turn those shoulds into musts, to find a way to keep our workers safe. And we're talking essential workers, we're talking non-essential workers. Thank you.
Randy?
Excuse me. Thank you, Mr. Mayor. I just wanted to weigh in on some of the things that have been said. I do like the idea of a robust education campaign and working with our stakeholders to roll that out and do the best we can to encourage adherence to that. As far as protections for workers that want to wear masks but feel like there will be retaliatory measures, I've seen in the news, it wasn't in Tempe, but there was some restaurant somewhere that said you can't wear masks, and that made some folks uncomfortable. I would support something along those lines to protect the employees that want to wear masks but feel that the environment that they're in is hostile to masks. And I don't have too much concern about requiring workers to wear masks either. So I know that's a cost to the business, but as the Vice Mayor pointed out, it is relatively cheap. I couldn't support mandating customers wear masks for a couple reasons. One, it's completely unenforceable. Two, I worry that something like that would create kind of unfortunately, COVID's kind of become politicized, and it creates a backlash where people are intentionally flaunting that law and, antagonizing police and so forth in Tempe's restaurants and soon to be bars whenever they can open. So I think that would lead to more ultimate harm than good. I did really like the idea from the public commenter earlier about the city taking the lead and compiling a list of places that we deemed socially responsible during a pandemic. And, whatever those guidelines may end up being, like we have the equal pay certification and we have the green business certification, like something voluntary like that, and say, look, I was at the Vine for lunch yesterday, and every other booth was completely roped off. So you could not sit anywhere near anybody else. And I thought that was a really smart way of doing it, rather than relying on a host or hostess to make sure that the place doesn't get too packed and keep everyone socially distant. So maybe if we set up some requirements, some guidelines to get this certification, the socially responsible certification, whatever it is that we want to call it, that would be a really good starting point to kind of encourage and incentivize volunteer compliance with a lot of the things that we're talking about and that we're concerned with. So I just wanted to throw that out there. That's it for me. Thank you. Randy out.
Thanks, Randy. And I want to let everyone know, I know I'm meeting with the DTA and the stakeholder group tomorrow, but the DTA is already working on a list like that. And I can also ask Local First as well as the chamber, and then we can look at some messaging. And I do agree with what's been said from Councilmember Keating as well as Navarro and Arredondo Savage. What about Councilmember Adams or Councilmember Chin? Are you good with what's been said?
Yes, hello, Mr. Mayor.
Yes.
I do like the idea of having task force come up with ideas. Obviously, safety should be first, and I like the idea of wearing masks. I think what Randy said about doing the certification program, I think that's really a good idea, and people could go to those restaurants and that want more safe measures in place.
Great.
So that's where I'm landing on it. And
Thanks.
also, second is if after you have your meeting tomorrow, if we can get something out to the public as soon as possible, as far as how that goes, I think that would be really helpful, just to keep our public informed as best we can. Thanks, Mr. Mayor.
Thanks, Mayor. I agree. I think the conversations with stakeholders, with DTA, Chamber of Commerce, I think they're critical in implementing and getting buy-in to following these practices. I also feel uncomfortable mandating since it would be difficult to enforce.
Thank you. I'm going to turn it back over to Andrew. Andrew?
Thank you, Mr. Mayor and members of council, for your input and feedback to our presentation this afternoon. It was helpful, and I just wanted to summarize and underscore a couple of things that were said. First of all, that our reopening advisory group will continue to utilize June 15th as their target date, subject obviously to events and circumstances changing, but that I think it's helpful for them to hear what I'm interpreting as support for that as a target by mayor and council, so that can also be something that the public can know and expect as we move closer towards that date. So I think that was helpful to have that conversation this afternoon. Secondly, in underscoring and emphasizing both the enthusiasm for and the caution that Rosa Inchausti presented in her information regarding wastewater testing, and also our continuing appreciation for the longtime partnership that we have with ASU in many areas, and in particular with this testing research that's being done right now by Dr. Halden and his team. One of the things that when individuals will visit our website and visit the dashboard, that they'll see is some disclaimers. And those disclaimers are going to say, in short, that the research is ongoing, and that while we have not yet made any decisions or drawing any conclusions or making operational changes yet, because the research is still ongoing, that we, at whatever point it is that we know that that research has been vetted and peer reviewed, that we are very much interested in taking what we think we know and what we do know now and making that more and more a part of things that we can do and that we can share, hopefully, around our region and around the nation. So that is something we're very appreciative that we are able to use that data that's being analyzed by ASU through Dr. Halden and his team with that caveat. And I just wanted to underscore that point that had already been made by Rosa Inchausti. And with that, again, thank you for your attention to this and to this update. And we very much appreciate Council and Mayor and your feedback that you've given tonight. Thank you.
Great, thank you. And again, thank you, Andrew, to your leadership, as well as to Judy Bauman, Chief Reese, Assistant Chief Duty and Glass, and Jeremy, thank you for your help with the regional, the reopening advisory committee for the city. And Rosa, as always, thank you so much. Okay, with that, we're going to move on to item number 2B, which is a Tempe streetcar extension feasibility study. And I'll now hand this over to Mr. Eric Iverson and Marilyn DeRosa.
Thank you, Mayor Mitchell and members of the council. Can you guys all hear me? This is Eric Iverson.
We can hear you.
Okay. As you mentioned, Mr. Mayor, I am on the phone with our Director in Engineering and Transit, Marilyn DeRosa. And I don't know, Marilyn, if you wanted to say anything before we get into this presentation?
Nope. Everybody knows you and they know how hard you work. So go ahead.
All right, thank you. So I will try to, recognizing your busy agenda, I will try to go through this as efficiently as possible. Before we go into, I just want to mention, obviously it's we do have Valley Metro staff that are available to answer questions if we need to, and they are listening on this meeting. It's obviously a tough time for public transportation, as you all have been hearing and witnessing across the globe. We are responding to that in Tempe with a great team. It is really fluid, and we are trying to stay on top of it and lead the way, as the last presentation demonstrated. So we're trying to do that in public transportation as well. And then just a shout out to all the public transportation workers that are keeping our service going and keeping this essential mobility service for the community operational for those that need it the most in these times. So with that, this is a update on this Tempe Mesa Streetcar Extension feasibility study. And we have been to the council twice before on this item. This is the meeting where we're asking for a little bit of recommendation or action. And I'll get to that at the end of the presentation. So next slide, please. These are the two performance measures that this project, this study is attached to. We are looking at improving mobility and transportation options for folks and creating the 20-minute city. And then we are continuing to try and improve our transit service in Tempe and get us to the point where we have a very satisfied community with our public transportation. Next slide. The purpose of this study is that we are looking at future possible extensions for the now under construction streetcar project in downtown Tempe. So that's a 3-mile project. We're looking at where is the next likely extensions that could happen in Tempe that make the best sense. The study area that we're looking at is mapped out on the screen before you. We looked at Baseline on the south, Priest Drive on the west, Country Club Drive in Mesa on the east, and then the river or the 202 freeway on the north. We did partner with the city of Mesa. They are an equal financial partner in this effort, each city contributing $300,000 for this study. And then we are working with Valley Metro as our regional transit agency to lead the study. We again are here tonight to share the results of this study that's been going on for about 14 months and then seek your recommendation on our next steps. Next slide. So as everyone is familiar with in the community and the council, we have been doing an extensive public outreach with this project, like all of the rest of our transportation and city community projects. So these are the boards and commissions that we have gone to now twice at different key points in the study's progress. We have also shared information about this extension study at our public meetings for the current streetcar, as well as with the Urban Core Master Plan public meetings that have been occurring. And then we just most recently went to the Transportation Commission this week or this Tuesday, and I will share with you what they said when we get to the appropriate slide. And then again, we have been before the council twice with this project to share with you key findings at key points along the study's effort. Next slide. This is a graphic of the process that we have gone through to get to today. So we did a series of steps in the process, and we shared with the council at Tier 1 and Tier 2, which I will review in the next slides. And then again, we're here for action on the recommended future possible corridors. Next slide. So at Tier 1, hopefully everyone remembers, I think this was in May of last year, we shared the results. Essentially what we looked at that point was we reviewed all the streets, the major streets in this project area, and we reviewed them for the feasibility of having streetcar on them as it relates to population and employment density. So this was a high-level look at where people live and where people are going and where they work, and which streets are connecting people to those places to the best. So we essentially created a tier or a rank of all those arterial streets that you see here, and we did share that at the time with council and with our boards and commissions. Next slide. In the second phase of this study, we called it the Tier 2, and that's where we did a deeper dive on that population and employment density data, as well as many other factors that you are all familiar with, and how we determine where major investments of this scale go in our community. So we looked at where, in all those streets that were in Tier 1, where are utility conflicts, what kind of right-of-way availability, what's the cross-section of the street, how would rail fit into those corridors. So you can see we've done exercises. Valley Metro has made renderings that show kind of how the rail system could be integrated in with our roadways. We looked at some high-level cost analysis, and then again, we're really focusing on what the conditions are today with where people live and where people work, and then where the future growth is anticipated. And so ultimately, we're looking at what has the highest ridership potential for a corridor of high capacity transit like the streetcar. Next slide. And then with that deeper dive, we shared with the council in February of this year the results of that. So many streets in the study area dropped off as priorities, and these 5 corridors, these 5 streets emerged as the highest performing, highest potential streetcar extension routes. So streets like Rio Salado, east and west on Rio Salado, streets like Mill Avenue, several streets in Mesa. The Mesa corridors were kind of all put together, and then we shared that with the council in February, and this is meant to show really the highest potential corridors for ridership for future streetcar extensions. And then we took that information of those prioritized corridors, those top performing 5 arterial corridors, and we looked at other major high capacity transit efforts that are happening right now in Tempe and in the region, looking at things like bus rapid transit, which is a new technology that Phoenix is advancing, and the region is looking to try and advance in other parts of the region. And there's other light rail, future light rail initiatives that are being studied in cities like Chandler and Mesa. So we wanted to make sure that with those other large scale high capacity transit investments, that we were not duplicating streetcar on those same corridors. So for example, Rural Road obviously has a lot of demand for high capacity transit. It's emerging as a bus rapid transit preferred corridor connecting multiple cities. So it doesn't make sense for us to have streetcar and bus rapid transit on a street like Rural Road. Next slide. So taking all that information that we had in the tier 1 and the tier 2 and all the data that led us to those prioritized corridors, and then making sure that we were not duplicating transit services on major corridors, the study is recommending that these 2 corridors that are circled on the map are what is in the final analysis for the study, and what is it is what staff is advancing to MAG through Proposition 400E for consideration. It is in concert with what Mesa is also looking at to submit to forward with their Proposition 400E submittals. The corridors are Rio Salado east and west from Priest all the way to the Mesa border. Again, we're just including Tempe in here, but the Rio Salado connecting into Mesa is one of the corridors, and the other corridor is South Mill Avenue to Southern, and then Southern east and west to our border, east to our border at Mesa. Again, anticipated that we would continue, this project would ultimately continue into city of Mesa. Those are the 2 corridors that are recommended in the final study. That is what the Transportation Commission also supported on Tuesday. And it is important to note that there's no funding commitment at this time. These will be corridors that will be reviewed by our partners at Maricopa Association of Government. They are corridors that the council will have a chance to weigh in again on if these projects do in fact get advanced into something that could be in Proposition 400E. There will be other points of decision making that the council will have before there is a funding commitment. These are long-range plans, and just need to emphasize that. And then there is one more slide that we'll go through before we take any questions. So next slide. Oh, maybe the other slide was, we did have a next step slide, which essentially says that we want to take the council's recommendation, take that council recommendation and continue working with Valley Metro, continue working with Maricopa Association of Governments, and then integrate this in with our Proposition 400E efforts that I know the council has been updated on and will continue to be updated on. With that, I will take any questions.
Great. Thank you so much, Eric and Marilyn. Thank you for the information. Hey, Eric, real quick, the 400E, that's the tax that the MAG is looking at, correct?
Correct. So that's the
gas,
a lot of
the transit. I mean the tax.
Yeah, that's what we call our public transportation funds. It funds a lot of, if not most of our bus and our bus operations in the region, and other transportation projects. So for example, the I-10 project that we're all gearing up for, that is a project that was included in Proposition 400. 400E is looking at looking at taking to the public an extension of that public transportation funding. That Prop 400E is what that is called.
Yeah, and I know there's going to be some more discussion because I know at MAG we've been talking about this, and as a chair of MAG, the challenges of delaying it until after the election and moving it to 2022 for a vote, and also knowing what the circumstances could be regarding the environment right now. Obviously, what we're seeing. I have hands up. I would look to let me go with Councilmember Arredondo Savage, as she's our representative on Valley Mitchell. Then we'll go to Vice Mayor KUBY and then Councilmember Adams.
Thank you, Mayor. I really do appreciate that. You know, I just got to take a quick second to let Eric know that he has done a really fabulous, excellent job, him and the team, in regards to representing the city of Tempe and all of our needs, our residents' needs, when it comes to transportation in Valley Metro. And the advancement of the streetcar, I think, is something that we all want and hope we see down the road. It seems so crazy that we've been talking about this, Eric, for what did you say, 14 months in regards to the extension and doing the study, which I think was thoroughly done. I think you guys did a fabulous job of the outreach and getting the right feedback and finding those routes that we think could be successful in the future. So I certainly support, you know, the recommendation of Rio Salado and Southern and Mill, if, like we say and we talk about, if there's money in the future. So based on the work and the input that we received, I certainly do appreciate that. And Mayor, I just got to say, I think our transportation team is really phenomenal and have done some really outstanding work and have really embraced these challenges with COVID-19 and trying to do everything that they can to keep people safe, from the employees to the riders, and continuing to have the best service available. So thank you for all your work, Eric, and thanks to the transportation team too. Always appreciate you guys.
Thank you.
Mayor.
Great. Vice Mayor, then Councilmember Adams.
Thank you, Mr. Mayor. So Eric and I had a voluminous correspondence this week, back and forth, not on Zoom, and I so appreciated the time and energy you took to answer the questions I had. So if I could just ask for your patience, Council, I just want to go through the list, because even though I'm satisfied, I think they're good questions that the public may want to know about. And one is the cost that's listed as our cost for the current phase 1 streetcar is $66 million a mile, and that's $200 million for the whole project. The cost of the projected streetcar is $177 million. So that's much bigger than 66 million. From 66 million to 127 to 177. Can you explain why the costs are projected to be so much higher?
Yeah, so as you know, and I know that others on the from Valley Metro are listening too, I too have expressed a concern about the cost, and I shared that with you, Vice Mayor. The current cost of the streetcar is, we consider it, even though these are really expensive projects, they're about as expensive of a transportation project as you can do, a rail investment. We do think that the cost in the long term is something that you're building sustainability, long-term sustainability into your community, and so that's part of the expense. The current streetcar project is working within the right-of-way that we have available. We did very little land purchases. We don't have dedicated transit lanes with the streetcar project that we have today. So we really, without giving you a lot of detail, we really did integrate in the current project with the existing street system, the existing network that we have, without a lot of enhancements to the project that you might see that we have seen with the light rail projects. We are putting in a higher cost estimate. We are putting in the cost estimate in this project for future extensions to try and identify that the cost may be that high if you want to do things like having dedicated lanes, if we need additional right-of-way, and to really protect us from any surprises that may come up when we do these projects. So I think that there is some room to get that cost down, and really we can do something that kind of more matches the current project. And then, so there's some room there. I also would just say that we're looking at future dollars too. So these numbers have been inflated to match some estimation of future dollars.
I understand, but I also know that the cost of the maintenance and operation of the streetcar was originally projected at $4 million, and now it's at 5.5 to 7 million. So just I know we're not deciding anything tonight, but just wanted to raise that. Number two, this came up at the Transportation Commission meeting the other day, but shouldn't we evaluate the success of phase 1 first?
Yeah, I think that's a great suggestion. And I know that we, Councilmember Arredondo Savage hears about this. We want to make sure that the ridership and the public response to the route that's now under construction, that is in fact a success. And we monitor all of our 26 routes in Tempe, of course. I will say that I feel personally strongly that the streetcar ultimately making connections to places like Tempe Marketplace or the Tempe Public Library complex would ensure greater success of the system.
Great, thanks. And then how does Mill Avenue rise to the top? I know it's the study, it's based on current and future density when it didn't before, for phase 1. Was it just that the Mill Avenue ranked high, but just not high enough for phase 1? Why is it suddenly doable, or it wasn't?
Yeah, that's also a great question. The short answer is that basically the starter line that we're building now, it competed okay for federal dollars when it was looking at Mill Avenue South, but it did not compete very well at the end of the day. Connecting this, doing the project that we're building now and connecting to the densities of ASU, the destinations and the densities on Rio Salado and in the downtown, we're able to capture all those numbers, those employment and ridership and population numbers that are in the downtown, and then build from that. So future extensions would be looking at the data that is in the downtown as well. And so that standalone project, the original alignment from 10 years ago or so, did not compete well enough for those federal funds.
Okay, and then the fourth question, the penultimate question, it's about COVID-19. We're in these COVIDian times now, and we've seen pickup of transit transit's taking a hit. And that could be for the foreseeable future. So how do we start thinking about streetcar, which is a slow people mover, in these COVIDian times? How do we contemplate moving forward when there's so much uncertainty in front of us related to COVID?
Yeah, this is what we're talking about every day. One thing that should be noted, and I know, again, Councilmember Arredondo Savage has been really involved in this. We are doing temporary and permanent things on all of our transit fleet, from our smallest buses to the trains, to encourage social distancing through signage. The trains have a separation between the operator and the passengers, so we have built-in protections for the operators. We don't know long-term what else will be required or will need to happen with public transportation. We do see a continued role globally for public transportation, even in declining ridership that we're in right now. We don't think we'll be in this phase forever, but we do see that this is providing transportation for those that need it the most in these time periods. And there are things that we're doing both temporary and a little bit longer term to protect both the operators and the passengers that are riding.
Yes, and we often hear our residents, we hear experts talk about transformative ideas and how we could maybe see in Prop 400E some transformative ideas. And one of the topics that comes up for ideas is making transit free.
Yeah.
Because if it's such low ridership, we might really have to do that to encourage ridership. And it's just an idea that would have to be funded regionally. We couldn't afford something like that. But when we spoke, we were writing back and forth, you mentioned that the BRT doesn't have to compete with the streetcar, that the bus rapid transit can happen with streetcar, which made me feel much better. But I wonder whether we can sometime get a MAG BRT feasibility study presented to us in council to learn more about the feasibility of bus rapid transit on rural.
Yeah, we'd love to. And we had started advancing doing public presentations for the BRT. In fact, I think we're back on to scheduling going to our Transportation Commission and the Sustainability Commission. We can certainly come and present with MAG or just Tempe staff the status of that BRT regional study that's currently underway.
Thank you. If that's the will of the council, and thank you for answering my questions. Thank you.
Councilmember Adams.
Yes, thank you, Mr. Mayor. First of all, great job, Eric, for your informative presentation. You are always a rock star when you do these presentations, so thanks so much. And I really appreciate the amount of public outreach you did. It's good to see so much neighborhood, in particular, outreach. So we want to make sure our neighborhoods are informed and included in the decision-making process. So thanks for doing that. I know light rail has been instrumental in development improvements, for example, Apache Boulevard. And I'm just questioning what would you anticipate for improvements on the streetcar routes?
Thank you for the comments, and that's a great question. Part of the reason why the streetcar project and the streetcar extension study has been presented hand in hand with the urban core master plan is because we recognize that there's conversations about development or redevelopment adjacent to rail lines. We want to make sure that we're handling that in concert with that any development effort that's happening or any master planning effort that's happening in our community. I would say that what I've said for a long time is that the streetcar project, I think, can both stimulate and help to encourage redevelopment where appropriate. And I think it can also help to preserve and protect neighborhoods and historic sites, locations that Tempe wants to protect as well. So it is our intention with the streetcar project to first and foremost provide good transportation options for people, but to also where appropriate, where the council and the community feel appropriate, encourage redevelopment or maybe intensification. Places like Rio Salado, along Rio Salado between Marketplace and Tempe Marketplace and downtown. And then again, to also protect some of the greatest historic and strong neighborhoods and sites that are in downtown Tempe. So that's kind of how we look at it, is that we think it can achieve both. We also finally, or one final point is as we do have a TOD, a transit-oriented development code in the city, and that kind of helps guide development where along the rail lines, where it does happen, where redevelopment does happen, to encourage that development to be more friendly to riding transit. So, things like front doors of businesses are on the street and kind of facing transit. So we do look to the TOD to help guide us on any development that does occur.
Great.
Okay. So are there any estimates about how much money it could inject into our economy in Tempe?
This study did not look at that. However, as you know, Councilmember Adams, there has been, we can provide the council with information on what the light rail project has generated in the way of development, infusion of sales tax support. We can provide that to the council.
I think that would be helpful because it is a very expensive proposition. So I just want to make sure that we're really balancing everything out. And I also am supportive of the Rio Salado extension and Southern and Mill, just for the record, if we decide to go forward with it. Thank you, Eric and Michael, for your great presentation.
Thank you.
Eric, thank you so much. And thank you, Marilyn. And I know the work that, Eric, that you've done on this. And I want to thank Councilmember Erdana Sabres for serving as our representative on Valley Metro. Having been the chair of Valley Metro, I understand the long hours and the long meetings. But this is something that, I forgot, I don't know if it was Councilmember Adams or not, mentioned about the value it would bring But we have to look towards the future and traffic congestion, and things will be changing differently. So I think in the long term, I think this will be really, really beneficial along the Rio Salado corridor. And I am in favor of the Tier 2 study results, having the high ranking on Rio Salado. And I do want to thank staff, Eric, and your team for really integrating the study with the other studies that we have, but also working with the state and the region. And it's so important how we analyze the future extensions of the streetcar, how it fits into, I think, the rest of the regional network, if you will. So thank you for that. One other thing is can you explain a little bit further, and briefly if you can, on the pros and cons of center running versus mixed flow turn lanes?
Yeah, I can,
with the streetcar.
Yeah, I can quickly explain. I mean, and this came up with the Transportation Commission. Essentially, the current streetcar project that's under construction is in with traffic for
Correct.
a large portion of that 3-mile route. That slows down the streetcar system. It slows down you're in traffic. Obviously, the light rail system is in a mostly dedicated travel lane or transit lane, and there is a greater efficiency that you gain by having dedicated transit lanes. One of the comments I think I failed to mention that came up at the Transportation Commission was strong support for future extensions of rail in Tempe to include a look at dedicated transit lanes for that system. And when I say dedicated transit lanes, it could be that it's not just the rail system, but it could be our other buses sharing that travel lane so that the public transportation system moves more efficiently.
That's a good point. Councilmember Adams, do you have another question?
Thanks, Mr. Mayor. I am also quite concerned about the traffic on Rio Salado, and that is the reason why it's my first choice for doing that extension. Thank you.
Thank you. So it looks like, Eric, I think majority of the council is looking at recommending with the Tier 2 study results, if I'm reading and writing down everything I've heard. So thank you very much. Anything else you have for us, Eric?
No, just thank you for your time and
Great
good
job.
to hear everyone's voices.
Yeah.
Mr. Mayor?
Yes, Andrew.
Thank you. Appreciate it, Mr. Mayor. Just before Eric leaves, there was some discussion about a BRT feasibility presentation, possibly. I just want to make sure the staff going to be presenting that, or is that the consensus of council on that point, just before we leave? That's all.
Okay. I don't think so.
Well, this is Lauren, I'm the one that brought it up. Just, we've never had BRT, bus rapid transit, in the city of Tempe. It's pretty exciting, pretty transformational. And so I would think, since it's being presented to the Transportation Commission and other places in the city, that the council would want to be made aware. I mean, obviously I could go to a Transportation Commission meeting, but could we ask each of the council members if they're okay with having a presentation?
Mr. Mayor, this is Jennifer. I would like a presentation on it, please.
Okay.
That works, Mayor.
All right. Anybody else? I think that's fine. We can have a presentation. Robin, you have a question?
No, I was just going to say, I didn't necessarily need the presentation. I appreciate the work of the Transportation Commission and look forward to their recommendation. But if it's the will of the council, that's totally fine too, because, we see their minutes and things within our packets. But a presentation is fine if that's the will of council.
Okay. All right. Thank you. With that, we're going to move on to our next agenda item, which is the paid family leave. And I will now turn this over to Rainey Broderick as well as Kathleen Broman. Rainey.
Yes, good evening, Mayor, Vice Mayor, members of council. I have a PowerPoint that I'm sure Greg is in the process of pulling up, and I'm assuming that you can all hear me fine.
Yes.
Thank you. Thank you. So I'm Rainey Broderick, your Director of Internal Services, and also with me this evening is Kathleen Broman. She is our HR Manager for Employee Benefits. and we're here tonight to talk to you about paid family leave. Next slide, please. So specifically, what we want to do is update you all on the six-sided partnership's recommendations related to paid family leave benefits for city employees. So we're going to go through a little bit of background and then talk about the recommendations and then seek policy direction from you all. Next slide, please. So providing an adequate leave system for our employees is important because it promotes work-life balance and contributes towards reaching several performance measures. Most importantly, it helps with achieving a low turnover rate and also helps with employee engagement. So it is a very important element of the benefit package that we provide to our employees. Next slide, please. Just by way of background, we presented to you back in October of last year information around our leave programs. And the general message that we delivered that night is that we do have a very generous and flexible benefit package when it comes to our leave programs for our employees. But, and specifically, very generous the more tenured you are in the organization. So the longer you're employed here, the larger the accruals are that you receive. But what we did find in looking at the data is that it looks as though, and it has borne out, that we have a gap for our less tenured employees. So based on the discussion we had that night, you all charged us with continuing looking at this issue with the six-sided partnership and come back to you with recommendations, which is what we've done. So next slide, please. So we convened a series of meetings with the six-sided partnership and had some very robust conversations and discussions. And the first thing we did with them was basically review the information that we had presented to you all back in October. So we made sure everyone understood the world the way it exists right now with our leave programs. And as this slide shows, we have quite a menu, very generous. In fact, we provide up to 17 weeks of FMLA, so we go above and beyond the federal programs. Next slide. So, but one of the other things that we did, and we had presented to you all, was an analysis of the use of FMLA for birth, adoption, care of newborn, for care of family members, and then also for employees on serious health condition. And we looked at the data from the last several years, and what we found verified that our less tenured employees sometimes do go into an unpaid status for part of the time. So for example, back in 2018, when we had employees who were off for birth, adoption, foster care, or care of a newborn for bonding, out of the 49 employees who used that benefit, 9 were in an unpaid status for part of the time, not the whole time, but part of the time. So we clearly, the six-sided partnership clearly saw and could understand and empathize with the condition or the situation that newer employees sometimes find themselves in. Next slide, please. But the six-sided also needed to balance and remember that we have a very generous cash out program. And in fact, in 2018, we cashed out over $900,000 to our employees for unused accruals. So keeping all of this in mind, the six-sided partnership has come up with the following recommendations. So next slide, please. Thank you. So the first recommendation, and probably the heart of what the six-sided is recommending, is that we replace catastrophic leave with a new plan called Supplemental Family Medical Leave. Just by way of reminding Council, the catastrophic program is really, the name tells you what it's for. It's for a catastrophic situation that requires an employee to be off for a significant length of time for either their own health condition or for a family member. And it did not cover what we commonly call the needs for birth, foster, or placement of a newborn, so for parental care. So that was clearly a place where the six-sided thought, this is something that we probably is a little bit outdated, and we could move towards a newer, more comprehensive program. And so that's the first recommendation. The second is to expand the eligibility for that also compassionate leave, which I know you all are familiar with, which is a very generous program where we can have employees donate to an employee who needs the time. We have previously had for both catastrophic leave, but for compassionate leave, and now for supplemental family medical leave, we want to make sure that we don't have a long eligibility period where we require an employee to be here a certain length of time. So we want to expand these programs to time of hire, essentially. So on day one, these would be available to an employee. And then the third point on this slide is that we are really waiving all of the requirements of family and medical leave based on time, accruals, and things that go around sort of that bureaucratic part of the FMLA, and making sure that the various categories that qualify for family and medical leave are expanded to these situations. Next slide, please. So a little bit more specifically, under supplemental family medical leave, as I said, it replaces catastrophic leave, and probably the most important point there is that it now covers for birth, foster, care of newborn, all of the parental elements. It's available at the time of hire. And just by way of reminder, catastrophic leave was 160 paid hours, full pay. And that's what the supplemental family medical leave would be. And the other key difference is the catastrophic leave only kicked in after 60 days of an employee being absent for one of the reasons. This supplemental family leave will kick in actually after 30 days. So it's available sooner to employees and should help bridge that gap quicker. And also, as I mentioned, the FMLA qualifying reasons, this supplemental leave, all of that is now eligible in that program. So just to not belabor too much detail, but I'm going to let Kathleen quickly go through the timelines on the three major reasons that people are off on leave so that you can see how this new program will work.
Okay, thank you, Rainey. Good evening, Mayor and Council. So in order to see what the new leave would look like, we've created these visual timelines that I'll walk you through for different scenarios that can occur. So the first scenario is the employee's own serious health condition. So an individual goes out for a health condition of their own. For those first 30 days, the employee can use their own banked sick time, vacation time, or any other paid leave. Comp time is something that comes to mind. But if an employee either doesn't have any time or they exhaust their time during that 30 days, they would be eligible to apply for compassionate leave donations and accept donations from other employees. Then after the first month, so on the 31st consecutive day off, if they're still out for that, basically that second month time slot, so from the 31st to 60th day, they would be eligible for this new supplemental family medical leave. So that would provide them with up to 160 hours of paid leave at 100% of regular hourly rate. So once they've completed that, so they've now been out 2 months, if they have moved into their third month and they are still out for their health condition, at that point in time, an employee can pick up, if they still have a remaining bank of time, they can go ahead and pick up using their sick, vacation, other paid leave or at that point in time, they also could go back on the compassionate leave list and accept compassionate leave donations from our employees. After that, should an employee qualify, we do have from the 91st day up to 180 days. So from that 6 to 9 month time frame, or I'm sorry, 3 to 6 month time frame, they would qualify for the city's self-funded disability protection plan. And then after that point, so when they hit that 6 month part, generally they will qualify for the state or the ASRS long-term disability plan, or in the case of our PSPRS folks, our public safety folks, they would stay on our plan. Next slide. So for care of a family member, so you have an employee who needs to be out to care for a family member who has a serious health condition. Again, for those first 30 days, employee can use their own banked sick vacation or other paid leave, or they have the option immediately to go ahead and request and apply for compassionate leave donations. Again, once you hit that 1 month mark, you hit that 31st day off, you're still out caring for a family member from 31st to your 60th day, your 2nd month in. You do have the ability to be eligible for that supplemental family medical leave and get that 160 up to 160 hours of paid leave. After that point, then you would go back. So on your 3rd month out, if you're continuing to be out, you can pick back up and start using your banked leave again, or you have the ability again to go ahead and be placed on the compassionate leave donation list. Next slide. And finally, for birth, adoption, foster, or care of a newborn, so parental leave essentially, or maternity leave, either or. From your 1st to your 30th day off work, it still works the same with an employee being able to use sick, vacation, or other leave, other paid leave that they have banked, or they do qualify or can qualify to go on that compassionate leave donation list. At the 31st day, so moving into that 2nd month, from the 31st to 60th day, they can receive up to 160 hours of full paid leave for that time. And then after that 61st day, so moving into that 3rd month, they would then be able to pick back up using any remaining sick or vacation time they have banked, or again, going back on that compassionate leave donation list. Next slide.
Yes, so just in summary, to implement these recommendations it requires changes to our personnel rules. We included a copy of those changes in your packet, but what we would need to do then is to come back at a regular council meeting and officially ask for your approval. And of course, before we do that, we need to review those with the merit board and get their approval. But the hope would be then that we would come back to you at a future meeting and do that. And we're happy to answer any questions. And as we said, we're seeking your direction. Thank you.
Thank you, Rini, and thank you, Kathleen, for the presentation. And you also just want to commend on the presentation that the last time you guys gave the city council was very thorough. And I know that it identified some gaps on paid leave coverage for, as you mentioned in the presentation, less tenured employees. And I do appreciate the work that you've done, and more importantly, the work that you guys have done with the six-sided partnership. And I agree with the recommendations that are coming forward to provide a few more benefits right away for some new employees. And just because you start a new job, life doesn't stop happening to individuals. So I think having that additional cover, that safety net for those rare situations, I think is really valuable to maintaining, and recruiting, solid employees for the city. And by evident, we're very fortunate to have the best city staff, I think, in all the regional dealings that I deal with in the region, but also throughout the state and working with the League of Cities and Towns and ASMAG. We're very fortunate to have the staff ready to do and to offer these type of benefits for our employees is something that's very special. And I think it's much needed, and we get, better look at the work that we're doing as a city, even during these times. So thank you so much for that. And I do really appreciate the work that you all do. And I see some hands up. I think we have Vice Mayor Robin and Senator Adams. So Vice Mayor.
Thank you so much. So I'm proud. I'm proud that Tempe is such a generous leave program, and Tempe's at the leading edge, I think, when it comes to caring for the well-being of our employees. And early on, Rini, thank you for that. You identified a gap in coverage for our less tenured employees. But I would add to that any employee who has a disability or a chronic condition, even in a family, that requires regular medical follow-up is also part of that gap. And having as much as 1 day a month off for a chronic medical issue means that you can use every bit of your sick time, because you get basically 1 day a month, and then you never are able to bank, no matter how long your tenure is in the city. So I still see inequity in the system, and it seems like it stems from employees being asked to use their own leave or basically rely on the generosity of others to cover the first 4 weeks right out of the gate. And we talked about the compassionate leave program. It's lovely. I don't know how many cities have it, but I also have heard from employees that said it's kind of subjective, that if you're well known and well liked, you might have no problem getting it, but there's employees who are less liked and who might have ongoing legitimate use of leave, but it's not really understood by the other people, so they don't get the donations. So there is kind of an equity issue there as well. So you have presented, you've come back to us, identified a gap, you have presented a change, but it's relatively minor because catastrophic leave is now named supplemental family medical leave, and it's expanded eligibility for its use, so that's a good thing. I'm glad of that. But the benefit used to kick in day 61, now it kicks in at day 31, so that is an improvement, but it still doesn't fix the fundamental problem which you identified, which is there are employees who do not and will not ever have that kind of time break. So if by waiving the requirement that employees exhaust all of their accrued leave before accessing this new program on day 31, we provided benefit to longer-term employees who will now get to keep a lot of their bank of accrued leave. But where have we filled in the gap? I just don't see where we filled in the gap. So let's talk about solutions. I think we can fill the gap, and we can fill it simply by changing the order of things. If the supplemental family leave, previously called catastrophic, comes first, and everyone gets the same paid 4 weeks no matter what. And then the employees may not need more than that initial 4 weeks, but for the really small percentage of people that do, and let's hope they don't, then they can supplement with the accrued time or compassionate leave to be available. And if we tack it onto the second month instead of the first, you minimize the number of employees who might actually need it. And still allow longer tenured employees to use their own accrued leave to extend beyond the time, so that still happens. And we could think about with compassionate, with the donated leave, give an incentive program. We can make it anonymous. We can have incentives. We can have donated as a matter of course, a day, an hour, a month, or something. Coming on right around to the end of this, my preference when I first brought this up to council was for 12 weeks of full paid leave for all employees who need it for personal or family, medical condition, a new child, whatever. If we can't have that, the most important part of what I brought up is to protect the employees who are most at risk of going into unpaid status. And they happen to be the less tenured employees, people that have chronic conditions, and must use their accrued time as they earn it, because they have medical conditions and they have to use it every month. So the only way to protect them, the gap, is to offer the family benefit right up front. I think that's what Flagstaff did. And without it, we really haven't addressed that gap that we talked about, that you identified. We just then offered yet another way to minimize the use of leave among those who already have the most, but we haven't really addressed the fundamental gap. So I would ask us to consider filling in the gap and being mindful of those who are less tenured, those who have chronic medical conditions, or those who have family members with chronic medical conditions.
Thank you. Robin?
Thank you, Mary. Really quick, Rini and Kathleen, I think one of the things that might be helpful, I was wondering, could you take a minute? I think we all understand as a council, but talk a little bit about the six-sided partnership, what the makeup is and what their mission is. I think that might be good for our residents to understand. And then I have some more questions to follow up with that, Mayor.
Okay.
Certainly, Councilmember Arredondo Savage, I'd be glad to talk about the six-sided partnership. They've been my friends as long as I've been here. So we have a very active representatives from our employee groups. So we have our four major employee groups who are covered by an MOU. So we have our fire and we have police. We have our supervisors and we have our line level employees. So those are four parts of the partnership. The other two parts are our confidential employees, and those are a smaller group of employees who aren't covered by an MOU, but perform certain functions. So they are in a group into themselves, but they don't have a formal MOU. It's an informal relationship. And then senior management is also a part. So senior management is the sixth side of the six-sided partnership. And we have monthly meetings. Sometimes it goes when things are a little calmer, once a quarter. Right now, actually, we're meeting every Wednesday morning at 8:30 because of what's happening with the coronavirus. And so this group, certainly working very closely with HR, is a resource for all policies that we basically have in the city over the years. And anytime we want to develop new policies or look at procedures, we vet everything, we get input and talk about almost anything that has an impact on employees' daily life. So it's not just benefits, it's policies around, safety in vehicles to, our wellness committees to, I can't even think of almost everything that HR does and many other aspects of the city touches the six-sided, and we get input from them. And then, of course, as a subsection of that, the four groups that have MOUs, we have very formal discussions when it's time to update those MOUs and talk specifically about many of the benefits. And so this group had some very interesting conversations and really spent time thinking about what they thought was the best offer to look at this gap that we have. And this was their unanimous recommendation about how to proceed. So hopefully I gave you enough of an insight, or I gave the residents enough of an insight into this six-sided partnership. And the good news, it's a very collaborative, positive relationship. I mean, we don't always agree on everything, but we have really good discussions, and I think get to good places because we're open to listening.
To that point, Mr. Mayor?
Yes. Whoa, wait a second, I'm not done.
Right, it was to that
Lauren,
point.
hang on, Lauren. This is Robin's turn.
Yeah.
Robin?
Thank you very much. I thank you, Rini, for that explanation. I think it's really important, not only for us, and I think for our residents to understand how much we really value the input of our employees. And I think when it comes to making sure that they are receiving the benefits that are most valuable to them, that they have a voice and a say in that matter. So I really do respect those representatives of the six-sided partnership and what they've done and addressing the concern that we brought forward. I think that, maybe we don't think it's perfect, but I will say, I think they did a really phenomenal job of identifying an issue and coming up with a solution. I mean, whether it was the name change, I think they talked about expanding the coverage, the eligibility, and the trigger date. To me, those are really good changes that identified some of the challenges that I think that we had identified prior. So I certainly do appreciate their work and the fact that they were all together collaboratively and supported this. I 100% support the recommendation and would like us to move forward with this and this only. Thank you, Mayor.
Thanks. Councilmember Adams?
Yes, thank you, Mr. Mayor. First of all, I want to thank Rini and Kathleen for a great presentation. Always good to hear your voices. So I'm really glad that you work with a six-sided partnership. That partnership was established way back in the day with Will Manley, and it's been very successful. I had the privilege of participating in it, and it really works well, and everyone has a seat at the table, which is so important for inclusion. It's important that for our employees to be supported, and I feel like this plan definitely moves towards the right direction. We do have the best employees, I think, in the state of Arizona, and everything that we can do to support them, not only with their leave time, but also in their work environments, and making sure that we're taking care of them both at work and at home. So thanks again for the presentation, and I appreciate moving forward on this. Take care.
Thank you. And anyone, as Councilmember Navarro or Councilmember Chin or Keating, want to say something before I go to Vice Mayor KUBY?
Sure. Yes,
Yeah,
Mayor.
All right, Arlene, then Randy, and then Vice Mayor.
Thank you, Mayor. First of all, I think the six-sided partnership is one of our great assets in the city, and the open dialogue that we all have together. I think this was a very thoughtful and intentional recommendation, and I think it looks great. Thank you for your work.
Thank you, Councilmember Keating.
Thank you, Mayor. Thank you very much for this presentation. I'm also very proud that Tempe is kind of leading the way as far as employee benefits and making sure that those that are experiencing illness, whether it be chronic or acute, are able to stay financially solvent and, I guess, healthy would be a word, but I'm not sure how good a word it is. But anyway, you know, and I really appreciate the thoughtfulness. I think Councilmember Chin really kind of hit the nail on the head that this was a very thoughtful and deliberate process. And, you know, I'm very much about that process, and I'm very pleased with the recommendations, and I definitely support moving forward with them. Thank you.
Councilman Navarro, then Vice Mayor.
Yeah, Mayor, thanks. It's been said the group did a phenomenal job. They looked at the issue, they made their adjustments, and it's been said that, you know, to have a group like this that can help support and get the best, although we can't satisfy every single person, I think they're doing it for the best intentions for the whole entire group and the whole entire city. So I know that they've seen and they understand the issues personally, you know, how people, especially when they're first on the job, to possibly have some struggles early on and they need some help and attention. I think this helps address that. And I like to say that, you know, Tempe, and I'm very proud of it, is one of the best places to work with the support of their benefits that we give our employees. And we by far are leading the way out of all the Valley cities. So I think it's great what we're doing. Thanks.
Thank you. Councilman or Vice Mayor KUBY.
Yes, and by the way, when Rini was speaking, I wasn't interrupting. I was using a parliamentary procedure of saying to that point, because I had a specific point to make about what she was saying. So that's why I did that. So the reason why I wanted to make the point was that we identified a gap. Rini identified the gap and agreed that the gap was there, but I don't know if tenured people, the people that are subject to that gap, were a part of the conversation. The less tenured people, I don't believe, are in the six-sided partnership. Maybe they are, and I'm just not informed, and I'd love to be informed. I brought this up originally because I saw great work that Flagstaff is doing with full paid leave for all employees who need it for personal or family medical conditions or child. I was hoping that we could follow Flagstaff's lead. I can see the will of the council is not to do that, but I think it's important to note that a gap is identified and that still exists. And I agree with Councilmember Arredondo Savage that we need our employees to have a voice and say in the matter. And I think it's very important that we have those who are in the gap be part of that conversation. And so that was the point I was trying to make. I'm disappointed, but I will go with the will of the council.
Thank you. All right, Andrew, I think you heard the consensus is with the recommendation of working with a six-sided partnership and what's been presented to us. And that, we're going to move on to the next item, which is item number D, which is the November 2020 bond election discussion. And I will turn this over to Mr. Ken Jones and Mark Day. Ken.
Thank you, Mayor. This is Ken Jones, Deputy City Manager. I have a very brief presentation for you tonight to discuss our capital improvement program and the associated bonding that we do, the bond election that we do to fund that capital program. Next slide, please.
Hang on one second. He's trying to get there, Ken. Hang on.
Okay.
All right. There we go.
Before I get into this, I just want to caution that neither I nor the council should speak or advocate on behalf of either voting for or against bonds that are issued by the city. This is merely an informational session. You can give me plenty of advice for how we carry out the bond election, but let's not talk about whether people should or should not vote for the bonds. Next slide, please. We know that our voters, our electorate, gets very involved in how we fund our capital program, and this is one way that we make sure that our electorate is involved, voting on bonds to fund our capital program prior to us issuing those bonds. So we address that welcoming and participative decision making. Next slide, please. So general obligation bonds, just to touch on it briefly, we know that the city can only use our secondary property tax for one purpose, and that is to repay bonds issued for voter-approved capital programs. So the voters approve the bonds for the capital projects. That's the only possible use for our secondary property tax, which we know funds a majority of the capital improvements that we make to the city throughout the year. And that those bonds are typically issued over a number of years, and that they coincide with or are less than the life of the project they fund. That's a very brief explanation of why we have general obligation bonds and how we use them. Next slide, please. So we have limitations that are imposed by state statute, which require us to stay under. There are actually two limits, a 6% and a 20%. We sometimes just refer to it as 26%. But we have limits on how many bonds we can have outstanding, the value of that, and it's based on the City of Tempe property value. We're currently under 70%, which is good. During the last economic downturn, many cities found themselves in a situation where their outstanding bonds were in violation because the property values dropped. We're not in any jeopardy of that. We also are limited by voter authorization. The voters have to give us the authority to issue those bonds. And we also know that here in the City of Tempe, the third limit that we have is we make sure that we can repay the bonds with the secondary property tax. These are the legal limitations on the screen. We also know that just financially structuring our bonds correctly, we have to make sure that we will have the revenue stream to repay the bonds. Next slide, please. This is just a brief history. We have gone to bond every 4 years for quite a while. So you all approve a 5-year capital improvement program, the CIP. We take that CIP, we show it to the public. These are the projects we intend to fund over the next 5 years. And then every 4 years, on even numbered years, we go to the voters and ask for authorization to issue bonds to fund those projects that are in the capital program. So the outlier here you can see is in 2012. That's the year following the Great Recession that we recognized that the policy that we had for setting our bond rates was ineffective when property values dropped. So we implemented the stabilization policy so that now we know that our voters, our property holders, will pay the same property tax on existing property that they did the year before, plus inflation. So that's worked out very well for us, and we do not have a problem collecting the revenue necessary to repay the bonds. Next slide, please. Because we get authorization for the entire 5-year CIP and come back every 4 years, there's always excess authorization remaining. That's going to be the case here. In 2020, we estimate there will be 178 million of prior authorization remaining. So we will go out again, as we have every 4 years for quite a while, and we will size the capital program. We will ask for the authorization necessary to fund that net of the remaining authorization. So this is the process we've used for quite a while. Tonight, we're gonna show you a alternative to that, only because a city council member during a meeting raised the issue and said, do we think that the COVID issue and the economic issues that follow will have an impact on voters' willingness to approve bonds? That's why we're here asking you tonight whether you want to explore other options. Next slide, please. So these are the programs in which we will request bond funding in November: water and sewer, street improvements, storm drains, public safety, park improvements, community services, and municipal infrastructure. We have remaining bond authorization, as you see on the screen. We have projects in the 5-year capital program totaling $525 million. When you subtract the 178 that we expect to have remaining, that gets us to we would request bonds of $349 million to fund the next 5 years in the capital program. Typically, every other year, we would have just come to you and said, this is what we propose for the bond election in November. The next slide shows an alternative, which is if the city council chose to and said, let's come back in 2 years for voter authorization. So we're worried about the electorate and the economy, and maybe not understanding that their property tax on their home won't go up to fund these bonds. It will be what it was last year plus inflation, and maybe the message isn't delivered clearly. And could we look at maybe requesting more bonds, or I'm sorry, requesting bonds more often, every 2 years in this case, and asking for less in each request. So in that case, if we only covered the first 3 years of the capital program, we would only be asking for 174 million. So it's the difference between approximately 350 million and 175. Those are the options that we're presenting tonight. And next slide, please. So really, this is not a financial question that I could tell you we have a strong feeling one way or another. This is more of a question of public sentiment. And if you're concerned at all about following our normal process and want to reduce the request to the public, we could choose to go and only get authorization to fund the first 3 years of the capital program and then come back for voter authorization 2 years from now. The downside to that would be that we're expecting that the cost of the election will be over $300,000. That means we would have to add another $300,000 2 years from now rather than wait our typical 4 years. That's all I had. And like I said, Mayor, we were addressing a question that came from council members. Normally, we would suggest, and I still suggest, that 4 years is the best way to do this. Go for the whole 5-year capital program, the $349 million. But if you, as representatives of the taxpayers, have any concerns that people might look at this differently than they have in the past, and we've never had a bond election even come close to failing because we deliver a lot of information to the public about what we're doing, and they're always very comfortable because the projects and programs that we have out there funded by the bonds make a lot of sense to our public. So I don't have the concern, but as representatives of the public, we wanted to make sure you had the chance. And Mayor, if I could, I just want to clear up 2 issues. In the memo, a couple of things have changed. In the memo, we have a draft bond program that mentions municipal facilities, infrastructure, and golf. Our bond counsel, our outside bond counsel has said there's no reason to be that specific. Municipal facilities and infrastructure covers that. So if we were to do work on the clubhouse at one of the golf courses, it would be covered. You don't need to specifically mention golf, and there's really no reason to do that. So we're going to remove that language. It's never been in there before. We're going to take that out. And then also in the memo, it mistakenly says that we will ask you to take formal action on calling the election in June, on June 11th. But the fact is, we have to come to you on May 27th in order to satisfy statutory requirements. So we'll be back to you with the formal question on May 27th.
Great.
That's
Thank
all
you.
I have, Mayor, and I'm happy to answer questions.
Thank you. And before I go to Councilmember Keating, Ken, I want to thank you for giving a nice overview of what the bond election is and how it does fit into the city budgets and how we pay for capital projects like parks, recreation facilities, increasing our aging infrastructure, of course, our streets, and public safety. But I believe it's appropriate to size the election to cover a 5-year CIP. I think that'd be consistent with what we have done in the past, as you mentioned. And I also agree when you mentioned that, we worked hard really as a council and as a city to establish and maintain the trust of our residents. And we are transparent to our community, and we communicate with our community and our residents about the projects that we're investing in for them. And I think it's up to them, once we communicate properly like we always have, and I know we will in the future, I think the voters will decide. Like you're saying, we're very fortunate to have the success we've had. I do think we should move forward to 5-year CIP. I'll turn now to Councilmember Keating. And anyone else have any recommendations?
Thank you very much, Mayor. I agree very much with what you just said. I think Tempe voters are educated enough on the issues and follow the issues close enough to know what this is and why we need it. So my default position is to move forward with the bond election, the 4-year plan as recommended and proposed. I did have a quick question though for Ken. Let's say we move forward with the election, and for some unbeknownst reason, well, I guess it'd be a known reason, but say it failed. Could we then go to your alternative plan as plan B and put the bond up again in 2 years?
Yes, council member, we could.
Okay, great. I still like the idea of moving forward for the 4-year bond. But it's good to know that just in case, the worst happens, that we'll get another bite at the apple, and the city, the important projects in the city and the important, public safety, the things that we must fund will continue to be funded in a big enough time frame to give us time to take another bite at that apple. So I'm in complete favor of moving forward as proposed. Thanks.
Thanks. Councilmember Ardano Savage.
Thank you, Mayor. Yeah, I agree with Councilmember Keating. I think that's really important to move forward with the recommendation from Ken Jones. I think that, like you said, our residents are very educated and have been super supportive, and really do believe that they want to sustain the basics within our community and our facilities, and that's important to them. I would also say too that we need to make sure that we have a really good messaging plan. Mayor, like you mentioned, I think that we want to make sure people, completely understand how it works, because it is a little complicated sometimes. But I think if we have the proper messaging, it's just gonna add to the knowledge of our residents. So yeah, I certainly support where we're going. Thank you.
Yes, Vice Mayor.
Yes, I concur with Councilmember Ardana Savage, and I would just agree about the messaging. And I think it's important to give examples, and if not in the ballot language, of course, we don't have room for that. But when we're describing it, to talk about it in less engineering speak, and use accessible language to talk about what some of these items, CIP items, are. Thank you. And I support going forward with a longer plan.
Councilmember Adams.
Yes, thank you, Mr. Mayor. Ken, a great presentation as usual. I'm supportive of moving forward with the bond election, and our residents are going to be really informed, I know, because of your skills, Ken, in explaining the bond elections to them. So thanks for that.
All right, I think that's the majority. Joel, I'm sure. Are you there, Joel?
Yeah, I support everybody. Yeah.
Okay. All right, Ken, thank you. I think you got clear direction to move forward with the 5-year CIP in November of this year. With that, I will now turn to the next items on our agenda. Is a call to the audience for the committee of the whole items listed under section 4A and 4B. However, there are no items under those sections at this evening. So we'll move on to the next section, and the items is items in progress. Does anybody have anything they'd like to update? Progress? Seeing none, I would now look to Mr. Manager. Do you have any announcements? Before I go to him, do you have any announcements, Andrew? Okay.
Hi, Mr. Mayor. I'm sorry. Can you hear me?
Yes.
No announcements. Thank you.
Okay, thank you. I just have two quick announcements. One, a sad one. I want to give my thoughts and prayers out to Jim Phillips, his family. Jim Phillips is a former council member here in the city of Tempe. I remember him very fondly. And his son is the famous Zoe Bowie, who has played a lot of charitable organizations for us. He's an entertainer. And I just want to let the Phillips family know that our thoughts are with you. And he was a valued member of the city council as well as our community. And again, congratulations to all the high school graduates that will be taking place virtually, which is kind of weird for me as my daughter is a senior at Corona. Congratulations to all the seniors in the Tempe Union High School District. And with that, we don't have any other future. We're adjourned. Thank you.